Bing, you were just playing with your band, right? Nice.
Yeah, the next time we're gonna have to.
Yeah, we're gonna get you set up here.
Thumbs up.
All right, everybody, welcome back to Hacked 2024. We're thrilled to have you here. Again, this is the third and final day of the Hacked Hackathon, brought to you by ACEP, the Emergency Medicine Innovation Collaborative, and our key sponsor, Point Click Care. We've got several other sponsors that we're going to acknowledge over the course of the next 30 minutes as well. We are going to be presenting our winners in just a few minutes at the top of the hour. But before that, very honored to welcome back to the stage Stephen and Christian with C-Booth Innovations. They are our winners from last year's Hacked 2023, here to share a little bit of insight with us from their experience and what they've got going on. And then we'll announce the winner shortly after that. So welcome back, guys.
Thanks, sir.
Thank you so much, everyone. It's really exciting to be out here. And thank you to ACEP for hosting this, because you go along this journey as ER physicians, and I think we all share this mindset where at the end of the day, we have to fix a problem that's in front of us. And that really translates well into doing a startup company. But really, it helped launch us and gave us some recognition and being able to have some validation from our peers and saying, hey, we have an idea, we have a product we brought together. Christian and I met as interns in residency, and we've completed our residency at LA County.
And it's great to start off an adventure with a friend that you know that you can collaborate with, who will tell you your flaws and work together to be able to go through a process like this in device development. We're happy to take you through what happens a year later after we have the honor of winning this award. Some things that happen is, first you got to go back and revisit this market and being able to understand that this is a large growing market that we're in. The ECG space and diagnostics. There's 55 million EMS runs per year. There's 140 million ER visits per year. And looking at, we're trying to get our products into this space. And what are the barriers and issues of being able to do this? And how do we achieve this? We also this better. We also now have voice of customer. So we're in with EMS agencies, we're in with hospitals now. So the voice of customer is now coming back, and we can share that we're having positive feedback. They're finding this to be simple, expedient, and consistent accuracy in the EMS environment. And in the hospital environment, they're finding this to actually change the process and making it easy, getting studies done faster and better, that they feel improves their labor costs and the workflow efficiencies. So going through the clinical and launch of a product is very difficult. There's a lot of steps along the way to getting this in the market, into space. A lot of stakeholders that you have to work with in order to get them.
So, I think you all start off with a great idea. And that when you're in the business world, because you're going to be dealing with engineers, scientists. These people are brilliant. They're so smart, and they understand their space so much better than you. I had to take on the role as a CTO. I don't know what that means. Every day you have this imposter syndrome that you're going through, and as you are raising this baby, and you're going through this process, and everyone in the room is just this brilliant genius that have spent billions of dollars, and here you are with an idea. But if you come to a process where you have a problem that you want to address and you have a solution, it's going to work. And you need to surround yourself with people that share that vision and learn how to work with those people. Even if they are a little, there's going to be nuances to that, but working with engineers, working with lawyers, working with business people that have different mindsets and goals I think that's part of what makes us successful, is that we know how to navigate those different personalities, get everyone to row in the same direction.
Yeah. Don't let him fool you. He's become a great chief technology officer and has done all the heavy lifting to be able to get there. You know, the next aspect is then launching and doing a sales strategy. And so this is the part as the chief medical officer I'm involved in helping to identify where can we introduce our products and what is the strategy to do this. There's a hub and spoke method of identifying a hospital and then going out through the spokes of all the different places that interact with them to create a product that crosses these continuums. There's also a spoke and hub model where we start with an EMS agency and get drawn into a hospital and find that we have shared efficiencies in both ways. It also leads to strategies for domestic market expansion and looking at who are the potential groups out there for distribution and how do you begin to develop a relationship with those distributors and understand the best method of being able to be efficient with a small team size as you're still starting out. We have locally focused on the California proof of concept. Basically, when you do this, you target and you look like where are the appropriate places to target. Well, a third of the population in California lives in these 3 different spaces. So then we find ourselves attending conferences within those spaces, developing relationships with EMS and hospitals within these areas to begin our experience. And we're now in multiple hospitals and multiple EMS agencies.
And what was interesting is when we were here last year, we put our pitch deck together, we came and we thought we had this really savvy pitch deck with a nice PowerPoint slide. And then as we grew and we recruit more savvy business leaders, we realized that our pitch deck was where we were and we're really growing. It's kind of naive, really. It's kind of nice to have that naivety. But we've partnered since then, and what you're seeing here is actually a severely redacted version of future pitch decks as we get a little more sophisticated in our approach to attacking markets. So it's not so, yeah, you have your idea, but getting your idea on a patient is a whole different battle. And one of the most motivational comments a strategic had to us after we did our pitch, they told us, just go sell one. That's it. Just go sell one. And to understand how much is involved in that was kind of this really neat way of throwing us this really hard, you know, hey, give us a goal. And so, you know, you have to have that mentality where, okay, we're going to go sell one, and stick your head down, just grind it out and get there. Because if you surround yourself with those people that know how to get it, get engineers, get scientists, get business people, and trust those business people to share your vision to get it out there and get it on just one.
And you have to understand your market. You need to know what the prevalence of your problem is. You need to know where the opportunities are and target where you would expand and how you would expand in a way that is feasible with your team, and then be able to project how far out can you grow before you require additional institutional support to be able to do that. Then there's operational issues that you need to address too, right? So from an operational standpoint, we have to understand an economic model and where do we save money? Where's our value proposition? Some of the value propositions for what we're doing is reducing cath lab activations, and there's $7,500 cost every time you have a false or dry cath that's performed. There's indemnity risks in terms of payouts for misdiagnosis of heart attacks. We improve the quality of the ECG and the algorithmic performance. We therefore can improve on reducing misdiagnoses and leading to these reductions in risk exposure.
And what sometimes that comes down to is when you're going to come up with your product that has this great idea and you're going to go solve this great problem, but you're still going to have to figure out how to make that financially viable to some acquirer or someone that's going to use your product. And what I found interesting along this journey is what resonates with person A didn't resonate with person B. And so understanding how to hit multiple constituents with a value proposition, it's really interesting because you don't know who the decision maker is in the room and how that's going to resonate with them. But having multiple value propositions along the way that hit multiple constituents is going to be some part of the key to your success. And you'd be surprised that what resonates with one person doesn't resonate with another.
Yeah. And then there's a quality management system that has to be stood up. This is so important. This is where a lot of time, every single minute spent here pays dividends later. And that's basically being able to put together your quality management system in a way that is defendable and
compliant, really.
Compliant.
So really, it's funny, we had a really important meeting with a large strategic, and they said one of the #1 deal killers for them is a lacking quality management system. So much so that they built in to their timeline of due diligence remediation of the quality management system. So for those of you out there thinking quality management systems, there's a lot of systems that you can invest in, but make sure you have someone that can really help you get through. So this is the most tedious part of your job, is making sure you're compliant with the FDA, you're hitting all your regulations, you're making your SOPs and your hazard analysis. It's really tedious, but if you put that extra work in early, that transition later to valuation pays off in spades.
And finally, you need to protect everything, right? So your strategy for protection has to be formed. You need to have an IP strategy of having parent patents and child patents, and being able to do freedom to operate searches, be certain that you are operating within a space that you're capable of achieving and protecting at the same time. At this point, we're 8 patents issued, 17 pending. We have foreign patents that have also been issued, and it takes a tremendous amount of effort in order to get to these spots. You can't do it alone. You need to have a team to do this, and this is everything that we've been going through, at least in the past year. So we wanted to provide an update and take on any questions.
Yeah. And go ahead, Bing.
What's your product?
Oh, for those, I don't know. Well, you guys weren't here last year, so we really wanted to. I don't know if we have a slide. So we made an EKG patch, and the goal was, number one, spread information. Everyone know that EKGs are done wrong most of the time, and that's just the fact of life. And we've kind of become complacent in saying, yeah, EKGs are done wrong, but everyone does it wrong. Who cares? Well, if only 2 centimeters of a difference can hide a heart attack, I kind of care, because I'm almost Bing's age. So I'm at the age where I want to know, do an EKG properly and do it rapidly. So we made an EKG patch that fits all adults. It stretches and fits everyone, uses only one cable, is backwards compatible with all monitors, doesn't show up on x-rays, radiolucent, can tolerate CPR. So imagine getting an EKG after ROSC. Can stay on the patient for 72 hours, use a one connector, allows you to do right-sided and posterior EKGs. It's simple, intuitive, and kind of democratizes the ability to get an EKG. We're really proud to say that we've rolled out in Escondido and Oceanside 2 large fire departments in our neck of the woods. We're rolling into other hospitals as well, because the goal would be get better data at the scene. We start having confidence in the data we're getting. Hopefully we'll see fewer false positive cath labs. I don't know if we're going to improve the false negative, because it's a black hole of data. There is no way to know if there's a false negative, because for those of you that are starting to do your quality management system, you understand a hazard analysis. There's no traceability to the event of a bad EKG. There is no traceability to the event of a bad EKG. So if you have a poor EKG and you're working your shift and they hand you an EKG and you sign it, you have no idea how that was done. We're all assuming it was done right. Unfortunately, every study shows 60%, 90% are done wrong. And I kind of got tired of being complacent. And so making a device and get it right every time was really what drove us to do this. And fortunately, we've been blessed that we've been able to partner with such a great team of providers. And even this IP part, like, we're a part of the team, but we have investors that have invested in us, and they're investing in our IP. So even as we go along, we're creating more IP and finding more patents to protect around us as we innovate and really up-rev our devices.
Yeah. Any other questions?
No. Well, thanks again for letting us present. I tell you, it's neat, because now on our slide deck from last year and our moving forward, we get to put on there ASAP Innovation Awards winner from 2023. So we're really thankful to have that ability to be able to do that. Thank you for all your time.
Thank you.
For emergency physicians and trainees, really proud to help make this possible. Point Click Care, thank you for your key sponsorship of this event. And then I'm going to recognize our prize sponsors as we go, and I'll invite them up to the stage to give the certificates and prizes to the participants. So folks from Visual DX, EB Medicine, and Informatics, if you're in the stage, I'm going to invite you up one by one. I'll let you know when to come up. And we'll have you gather up here with the winner for pictures and a certificate presentation. But with that, we'll get started. All right, so we have 2 runner-up prizes this year and then 1 grand prize. I'm going to start with the 2 runner-ups, and we'll do the grand prize at the end. The first one, I'd like to give a big thank you to Visual DX. If we have anyone from Visual DX in the audience, please come on up. Again, this is your AI-driven solution to support your clinical decisions for skin in the emergency department. Welcome to the stage. I'll let you give a brief intro to Visual DX, and then we'll announce the runner-up winner.
Thanks a lot. It's really a pleasure to be here. I am an interloper to this meeting. I am a dermatologist, not an ER physician. And we are a physician-founded company that recognized a need in emergency medicine because we know how much you all love rashes. And so we have a clinical decision support system that uses AI and machine learning to help all clinicians recognize patterns better, particularly dermatology. So we're really known for dermatology. I think this is our 13th year at ASAP. We always have ER physicians coming by and saying, I hate rashes, I love Visual DX. If any of you don't know of Visual DX, come and say hello to Kim, myself here. We'd love to talk about Visual DX. I'm going to talk about it forever, but what I'd really like to do is congratulate the winners of the Hack and prize. Yeah.
Awesome. So the winners for this runner-up prize will get a subscription to Visual DX, and you can go ahead and stay up here. We'll have you present the certificate too. So very excited to announce our runner-up for today, and that is Risk Benefit. So we have Vincent, Max, Anthony. Come on up to the stage. Congratulations. All right, and so what we'll do, if you want to present them with this, we'll just do it kind of in front of the screen here.
Yeah.
And then we'll get a picture. Yeah. Congratulations, guys.
Thank you.
I'll have you run over here. Congrats. Congrats. All right.
Thank you.
And then let's gather kind of in front of the screen so they can get a clear shot. Yeah. Perfect. Is it all good? Perfect. All right. Congratulations, guys.
Thank you.
All right. Let's hear again for Risk Benefit. Very well done. All right, moving on, we have our second runner-up prize. Very thrilled to partner with EB Medicine for this one. We've got Patrick O'Malley and crew coming up to the stage with EB Medicine. But again, your source to stay in the know with the highest impact topics in emergency medicine. I'll let them tell you a little bit briefly about EB Medicine, and we'll announce the other runner-up.
Hello, my name is Patrick O'Malley, and with me is Dr. Sam Ashu, who is the podcast host
Good to
for
meet you.
EB Medicine Simplified. But just a little brief history about EB Medicine. We have been in business for 25 years, providing high-impact, relevant clinical education. I think most of you are probably familiar with it. We're over at booth 3716 if you want to come by. I'm the creator of the laceration course and the abscess course that are done in partnership with EB Medicine, and we really value the feedback, the insights, and the input that we get from our audience, which really has helped us change and keep up with the times and really be a leader in clinical education for emergency medicine. So we're honored to be up here, and Sam will let you talk about the podcast for a second.
My name is Sam Ashu. I am the podcast host for the Amplify podcast. It's owned by EB Medicine. We do one educational piece a month and then one extra emergency medicine related piece a month, where I usually feature people who work in the field, something related to physician wellness, or something expanding the field like these kinds of opportunities in emergency medicine. So if you're interested in being a guest, or if you're a listener and want to talk, come by and see me afterwards. I'll be in the corner or at the booth, and we can talk about having you on the podcast.
Awesome. Thank you all for being here. So very excited to announce this runner-up. Again, you'll get access to EB Medicine and to connect with these incredible folks here. So the runner-up for this one is Healthcare Alliance for an Equitable World. Congrats. Come on up. All right, and I'll have you guys present this to them. Yep. Yeah, we'll come right over here. Yeah, congratulations.
Thank you. I'm gonna go ahead. So.
Yeah, either way. Yeah, perfect.
Oh. Thank you.
All right, let's hear it again for Healthcare Alliance for an Equitable World. Congrats. All right, and now the moment you've all been waiting for. You need a minute? Okay, I'll slow roll it. We are going to announce our first place prize. So again, this is based off the rubric that all the participants received, looking at things like your project design, feasibility, scalability, taking into consideration your presentations and demos today. We're really excited to partner with Inflamatics for this first place cash prize. And Inflamatics, again, if you're not aware of what they do, they're really focused on the host immune response and do a lot of testing to help diagnose things like sepsis in the emergency department more quickly and accurately. Do I have anybody from Inflamatics here? Okay. We'll go ahead and present it. Tim Sweeney and the crew at Inflamatics are probably busy over at their booth, but very excited to continue to partner with them and grateful for their partnership with this this grand prize. So without further ado, our grand prize winner, Native RX, Kalechi and Shaniqua, come on up. All right, congratulations.
Appreciate it.
Congratulations. All right, let's come on over here. And if you guys want to get, here, actually, let's maybe stand over here and then they can see your stuff. And we'll get your picture there. Amazing. Cool. Do you guys want to say anything? Yeah? Okay.
Yeah, not much else.
All right, let's hear it again for Native RX, our grand prize winners. All right, as we close out, I have certificates for all the participants, so I'll be finding you after as well. Do want to just give, again, a big thank you to all of the people that made this happen. Hackathons, particularly in emergency medicine, at a large conference are no easy task. So again, a big thank you to ACEP for their partnership with us, the Emergency Medicine Innovation Collaborative. If you're interested in an innovation in emergency medicine, swing on over eminnovationcollaborative.org. And very grateful to partner with ACEP on this event again. I'd like to give a shout out to our sponsors, our title sponsor, Point Click Care. We heard from them yesterday and very excited and grateful for their partnership. Our prize sponsors, Inflamatics, Visual DX, and EB Medicine. Thank you all for being here, for making Hack 2024 such a big success. And we have the space available for a little bit longer. We'd love to hang out and talk with you all a little bit more. Thanks so much.
Question. Do you guys provide investment opportunities?
We do. We are just starting to have a pitch event. It's focused on like early seed stage companies, but where we have like emergency physician angel investors and stuff.
How do you?
Yeah. Yes.